Most men don't realize their penis ages just like their heart, brain, or bones. Ignore it, and you don't just lose function, you lose confidence, dignity, and connection. Hello, I'm Dr. Mohit Kara. I'm a urologist and professor of medicine with over 30 years of experience in men's health, specializing in helping older men preserve not just their sexual function, but their sense of identity. What if I told you that the #1 cause of penile dysfunction in men over 60 has nothing to do with age and that simple daily care, not medication, would change everything? In this video, I'm going to give you 5 essential ways to take care of your penis, backed by science and tailored specifically for men over 60. These aren't gimmicks. They are real practical strategies that can save your health and your quality of life. And make sure you stay with me to the end, because I'll reveal a final bonus tip that most doctors never mention, but could prevent one of the most painful penile conditions we see in older men. Before we get started, if you haven't subscribed yet, go ahead and click that button and turn on the bell so you never miss practical age-specific health advice made just for you. And if this topic resonates with you, type 1 in the comments. If there's something you feel I could improve or explain better, type 0. Your feedback helps me serve you better. 1. Stay sexually active, even without intercourse. Let's begin with the first and perhaps most misunderstood part of caring for your penis as you age, keeping it active. Because the truth is, when you stop using it, your body starts losing it. When I speak with men in their 60s and beyond, one of the most common misconceptions I hear is this: I guess my sex life is over now. Many have quietly accepted the idea that sexual function fades with age, and there's nothing they can do about it. But let me tell you something important. Not only is that belief untrue, it can actually become the very reason function declines in the first place. Your penis, just like your muscles, heart, or brain, depends on use to stay healthy. When it's inactive for long periods, blood flow decreases, elasticity weakens, and tissues can begin to atrophy. That's not a scare tactic. It's basic physiology. The term we use is penile disuse atrophy, and it's far more common than most men realize. But the good news, it's also completely preventable. Sexual activity, including masturbation, isn't just about pleasure. It's about preservation. By keeping blood flowing regularly to the area, you're maintaining tissue health, oxygen supply, and function. Think of it like stretching a muscle to keep it from tightening over time. And if intercourse or solo stimulation isn't currently possible or comfortable, that's okay. There are other methods, like using a medically approved vacuum erection device, or even engaging in pelvic floor exercises that support circulation and performance. What matters most is that you don't go idle. Your body responds to use no matter your age. Beyond the physical benefits, there's another layer here that's just as essential: dignity and identity. For many men, sexual vitality is tied to how they see themselves. When that starts to slip away, confidence often goes with it. But staying sexually active in whatever way works for you can help you reclaim not just performance, but pride. It's not about being who you were at 25. It's about staying connected to who you are now as a man with wisdom, experience, and value. I've seen men in their 70s regain control of their sexual health simply by taking this first step. And more often than not, once they do, other parts of their health begin to improve as well. It's a ripple effect. Confidence, intimacy, motivation. They're all connected. 2. Keep it clean. The right way. Now that you know the importance of staying sexually active, let me show you something just as critical. It's something every man thinks he has under control until it's too late. Let's talk about hygiene. This might sound obvious, but after 3 decades of treating men in my practice, I can tell you proper penile hygiene is one of the most overlooked yet absolutely essential forms of self-care, especially as we get older. I've seen too many men walk into my office with infections, irritation, or even more serious conditions simply because no one ever taught them how to clean themselves properly. It's not about being dirty. It's about not knowing how age changes your body and how to adjust your care with it. As we age, our skin becomes more sensitive. Immune response slows down and the body isn't as quick to fight off bacteria or heal irritation. That means what may have been good enough hygiene in your 30s or 40s just isn't enough anymore. If you're uncircumcised, this becomes even more important because bacteria, sweat, and dead skin can build up beneath the foreskin, leading to infections like balanitis or conditions that increase your risk for penile cancer. Yes, cancer. And it's not rare. Brazil, for example, has one of the highest rates of penile cancer, and the #1 cause is poor hygiene. That risk doesn't go away with age, it increases. But the fix is simple. Wash gently with warm water and a mild, unscented soap. Nothing harsh. Pull back the foreskin if you have one. Rinse thoroughly. And most importantly, dry well. Moisture can be a breeding ground for bacteria, especially in skin folds. And always clean after sexual activity. Vaginal fluids, lubricants, or even just natural sweat and oils can throw off the balance of healthy bacteria on the skin. It only takes a minute, but that small daily habit could save you from painful infections, foul odors, or something far more serious. What surprises many men is the emotional shift that comes with this. When you take care of your penis the same way you take care of your teeth, your heart, or your appearance, you start feeling differently about yourself, cleaner, more confident, more in control. And that's powerful, especially in a world that too often tells older men to step aside or give up on their bodies. 3. Avoid sexual activity with a semi-erect penis. But hygiene is just the beginning. There's something else you need to know, something most men don't talk about until it's already caused serious damage, and it all starts with what happens during intimacy when you're not fully ready. Let's talk about a hidden danger almost no one warns you about. This one might come as a surprise, but it's something I've seen far too often in my clinic. Men unknowingly injuring themselves during intimacy simply because they didn't realize the risks of having sex before they're fully erect. It may feel like a minor detail, especially when desire and the moment are leading the way. But attempting penetration with a semi-erect penis can cause damage that builds up over time, and the consequences can be life-changing. Let me be clear. Your penis isn't just a tube of skin inside. It's a delicate structure of blood vessels, spongy tissue, and smooth muscle. When it's not fully rigid, it doesn't have the support it needs to withstand pressure. That's why forcing it to perform before it's ready can lead to what we call micro-traumas, tiny internal injuries that may not cause pain right away, but gradually form scar tissue beneath the surface. Over time, this scarring can harden and pull on the surrounding tissue, leading to what's known as Peyronie's disease. If you've never heard of it, it's a condition that causes painful curvature of the penis, sometimes so severe that intercourse becomes difficult or even impossible. I've sat across from many older men who were too embarrassed to mention the changes they'd noticed until it was too late for conservative treatment. And the truth is, most of them had no idea this risk even existed. They weren't being reckless, they were just uninformed. That's why I want to say to you now, slow down. Your health, your comfort, and your confidence all depend on treating your body with patience and respect. Waiting until you're fully erect before intercourse isn't just safer, it's smarter. It protects you from long-term damage and ensures that sex remains enjoyable and pain-free. Use lubricants to reduce friction and take your time with foreplay or stimulation. Talk to your partner if you're feeling pressure to rush. It's not worth the risk. And if you're using medications or aids to help with erections, let them do their job fully before proceeding. This simple act of caution could save you years of discomfort and frustration. And it's not about being fragile. It's about being informed and empowered. 4. Limit porn. Maximize real connection. Now that you understand how to protect your body during intimacy, we need to shift our focus to something that affects not just the body, but the brain. And it's one of the biggest hidden threats to real connection and desire in older age. Let's talk about the unexpected cost of too much pornography. I want to speak honestly here, man to man. We live in a time when access to adult content is easier than ever. And for many older men, especially those who may be single, widowed, or feeling disconnected, it can feel like a harmless way to keep desire alive. But after working with thousands of patients over the years, I can tell you this. What starts as occasional relief can slowly become a replacement for something much deeper and more fulfilling, and it can rob you of the connection you deserve. 5. Essential care. You need to take with your penis advice for elderly limit porn. Maximize real connection. I want to speak honestly here, man to man. We live in a time when access to adult content is easier than ever. And for many older men, especially those who may be single, widowed, or feeling disconnected, it can feel like a harmless way to keep desire alive. But after working with thousands of patients over the years, I can tell you this. What starts as occasional relief can slowly become a replacement for something much deeper and more fulfilling, and it can rob you of the connection you deserve. The truth is, excessive use of pornography rewires how the brain responds to arousal. It often trains the mind to rely on a very specific type of stimulation, fast, visual, and solitary, that doesn't translate well into real-life intimacy. Over time, men may find themselves feeling numb, disconnected, or unable to respond to a real partner the way they want to. It can even lead to a condition known as porn-induced erectile dysfunction, where the brain becomes so used to artificial stimuli that it struggles to react to normal touch or connection. I'm not saying you have to give it up completely, but if you find yourself watching more than you're engaging in real connection, even if that means emotional intimacy, touch, conversation, then it's time to rebalance. Because what matters most isn't performance. It's connection, touch, being seen and valued by someone else. And when you nurture those things, desire often returns in ways that feel natural and sustaining. This is especially important for men over 60 because connection, not just sex, becomes one of the most powerful predictors of long-term health and well-being. We're not meant to live in isolation, physically or emotionally. So take a moment to reflect. Are you using content as a supplement or a substitute? Are you hiding from rejection or reaching for connection? It matters. And the good news is, change is possible. Even small shifts in habits can reawaken parts of your brain and body that have been dormant. You deserve more than pixels. You deserve real touch, real closeness, real life. Know the warning signs and when to seek help. This final tip may be the most important of all, because despite everything I've said so far about staying active, being clean, careful, and connected, the truth is, sometimes issues arise that need medical attention, and too many men wait far too long. They ignore pain. They hide changes. They pretend everything is fine, hoping it will go away. I get it. There's shame, fear, uncertainty. But here's the truth. Early treatment leads to better outcomes, every time. So let me tell you some of the most common red flags you should never ignore. Sudden curvature or pain during erections. Lumps, sores, or growths on the penis. Unusual discharge or foul odor. Persistent itching, redness, or irritation. Difficulty achieving or maintaining erections that's new or worsening. Any injury, even if it seems minor, that causes swelling, bruising, or changes in shape. If you notice any of these signs, please don't delay. You wouldn't ignore chest pain or a broken bone. Your sexual health deserves the same care and respect. And seeing a urologist isn't about embarrassment. It's about empowerment, getting the information you need to make confident, informed decisions about your body. You've lived a full life. You've earned the right to age with dignity, comfort, and control. And that starts with speaking up and seeking help when you need it. Sometimes it's something minor. Other times it's the difference between years of pain and a quick solution. Either way, you win by acting early. The condition no one talks about. As promised, I want to end this video with one final bonus tip, one that could spare you from one of the most painful, often preventable conditions I see in older men. It's called phimosis. And while it mostly affects uncircumcised men, it's something everyone should understand. Phimosis is when the foreskin becomes too tight to retract properly. In older men, this often develops gradually due to scarring, inflammation, or chronic infections, many of which stem from poor hygiene or diabetes. What makes phimosis dangerous isn't just the discomfort. It's what happens when the tight foreskin traps bacteria and debris, leading to recurring infections, urinary problems, or even severe swelling that requires emergency care. And it's almost entirely preventable. Here's what you can do. Gently retract and clean under the foreskin daily. Moisturize with a safe, non-irritating emollient if the skin feels dry or tight. Avoid pulling forcefully if there's resistance. See a doctor instead. Manage diabetes and blood sugar, which affect skin health. See a urologist if you notice tightness, pain, or difficulty retracting the foreskin. Phimosis doesn't mean you're dirty or defective. It means your body needs support, and addressing it early can save you from surgery, pain, and loss of function down the road. You deserve to be informed. You deserve to be protected, and you deserve to feel proud of your body at every stage of life. If you've made it this far, thank you. I hope this message has helped you feel not just more informed, but more empowered, because aging isn't about decline. It's about adapting, evolving, and continuing to value yourself, your health, your identity, your joy. Your penis deserves care, just like every other part of you. Stay active, stay clean, be cautious, stay connected, and don't be afraid to ask for help. This is your life, your body, your story. Let's make it a strong one.